We're good to go, right?
Good to go.
All right. Um, so like you already know, my name is Patrick Chandiga Justin, and I work as the Executive Director of CECI, Community Empowerment for Creative Innovations. Um, Community Empowerment for Creative Innovations, CECI, is a refugee-led organization that works with the refugee populations here in BDBD refugee settlement in Uganda. And we basically respond to the need for resilience activities that increase livelihood through promoting peace and reconciliation, combating ethnic divisions, hate speech, gender-based violence, and skilling youth in conflict management and resolution, trauma healing, entrepreneur, and vocational skills, just to encourage self-reliance and support peace and development at the grassroots level. So that's like brief information about CECI. Um, Before COVID-19, basically, we were in programs that are centered on community peace building. And these community peace building programs have been centered mostly around organizing trainings for targeting various stakeholders, including leaders, youth, women, and also organizing football tournaments, cultural galas that bring together people from diverse backgrounds together to share, and also organizing youth exchange and exposure visits and these concerts, and also hate speech mitigation campaigns that we were running both online and offline, basically to enhance peaceful coexistence and social cohesion among the refugees themselves, but also with the host community. And this was basically in BDBD refugee settlement in Uganda. And we did this with support from Oxfam IBIS and the Dangerous Speech Network with funding from the Wellsprings Philanthropy Fund. When COVID-19 came in, I think it was not easy because we as an organization, we had to temporarily stop all our community peace building programs that were running in the refugee settlement. This is because most of these peace building programs largely depend on in-person gatherings. And so with the COVID-19 SOPs, and preventive measures, it became impossible for us to have these programs ongoing. And so we had to temporarily stop all of it. And instead, now we ventured into exploring ways of continuing with our programs beyond the traditional way of bringing together people. But now we're looking at how we will be able to continue with our programs in respect of the standard operation procedures. And I think the outcome of this helped us very much in reprogramming our interventions basically in the settlement. COVID-19 also came in with a lot of challenges, and I think it just made worse the already dire situation in the refugee camps. You know, refugee settlements here in Uganda are basically, at least most of them, are congested and they are overcrowded. A lot of people living in a very small piece of land, which is not safe when we talk about COVID-19 that requires social distancing and stuff like that. So, but also another thing that came along with COVID-19 was the increased levels of tensions and violence, especially among the refugees and also with the host communities. And I think basically this resulted from the overstretched healthcare systems, because basically in the refugee camp, the health facilities are very, very, like, I don't know, to say maybe fragile, because we only have health center, one, two, and 3, there's actually no hospital. And so with the days, it can serve the large population. For example, Bidi refugee settlement alone that has 200 over 270,000 refugees. So this also came along with the limited resources caused also by the pause of significant peace building programs that were running in the refugee settlement, because partners and international organizations had to pause their operations because of the COVID-19. Some of them had to withdraw their staff, and so important peace building programs had to wait. And yet, the tensions and the violence were not waiting, not slowing down at all. And also another thing that was related to these tensions and violence was the high levels of misinformation, uh, placing the refugee communities at a very high risk, the lack of PPEs as these healthcare systems, facilities are overstretched and do not have the capacity to deliver in terms of COVID-19 response. And also the limited access to information, basically for refugees, because refugees are like shut out of the world. They lack access to the newspapers, they do not have TVs, most of them do not have radios, and those that have radios cannot afford to buy batteries for it, and so many other things. So shutting them like out of information when it comes to COVID-19 and other important information. And also experiencing difficulties in implementing preventive measures. This is very, very true, especially with persons living with a disability and the elderly. And so because of this that came out with the COVID-19 situation, we as Community Empowerment for Creative Innovations, we had to do a mass community awareness on COVID-19 with the funding from Oxfam. And we did this awareness, which is currently actually ongoing for the last 3 months. And we've been able to reach over 9,450 people, both refugees and the host community members in the last 3 months in the BDB refugee settlement. We did this mass community awareness basically through the printing and distribution of translated IEC materials or COVID-19 posters that were translated into the common languages spoken by refugees, and were able to produce over 1,300 posters, both A3 and A4 sizes, that were distributed at public places like the food distribution points in the refugee camps, distributed at the health centers, and also distributed to households, basically to increase their access to information. And then this awareness was also done through the use of bicycles with megaphones loaded on it, and these megaphones had pre-recorded messages recorded in the local languages. So what happens is this is given to the village health teams, the VHTs, that then move with the megaphones in their community, in their respective communities, raising awareness through the use of this. And were also able, as part of the awareness, to establish a local community information center that was equipped, and actually equipped with the internet, with power, and also with the seats, such that the community can be able to come in, access internet, charge their phones, and also have access to reliable updates about COVID-19 timely. So that was like one of the things that we had to do because of the COVID-19. And in addition to that, we were also able to distribute hygiene supplies, personal protective equipments, radio receivers to 70 households of persons living with a disability and elderly. And this was basically in the Bidibidi refugee settlement, where one household received one radio 4 pairs of dry cells, uh, 5 bars of soap, basically for hand washing, and also 5 pieces of face masks, basically for protection, such that if these family members are moving out, for example, to public places or to receive their food from the food distribution points, they can have a mask on and protect themselves and also the community as well. And also a hand sanitizer to this household. So basically, this was able to benefit 450 people. We're not able to give to a lot because we had limited resources. Yeah, and another thing also was the rumor tracking. Like I earlier said, one of the things is the refugees struggle with access to information, but also in addition to that, there is high level of misinformation circulating in the settlement. And so we saw it important to have rumor tracking done, basically, and we were doing this through the use of tablets. These tablets were loaded with a rumor tracker tool developed by ULAN and IRC. And what happened was we recruited and rumor data collectors that we chose to call them as RDCs. These people move in the community and they collect rumors. So it's not like they go and they do, for example, a survey, but they come to the community and just do this like as part of the activities that they do and try to ask more open-ended questions so we can have as much rumors as possible from the community and understand the kind of rumors circulating and how we can share them with the stakeholders. So in the last 2 weeks, for example, we were able to record over 70 rumors in the Kobo tool. And majority of these rumors were more applying COVID-19. Like COVID-19 is so dangerous. When you have COVID-19, you're definitely going to die. There is no way you can survive. While others downplay it and say like, man, this is a political thing and people are just trying to play around. So this we had this rumor tracking done in a way that we, after collecting the rumors, we generate reports. We generate reports that are shared with partners in the coordination meetings, which are held monthly at the settlement level and also at the zonal level, basically to inform interventions and also other information that we collected along while conducting the rumor collection was collecting the complaints and the feedbacks, which were not recorded in the Kobo tool. And this helped so much to increase response to the rumors circulating the settlement by partners. And I think lastly, the other thing that we have been able to do is we've been able to launch a peace building project. This was last week, titled Sawa Le Salam, or Together for Peace. That runs through December 2020. This is basically because of the increased levels of tensions and violence among the refugees and with the host community. Recently, we had a very horrible incident in Chika 1 in Rhino Camp refugee settlement, where uh, 10 refugees lost their lives in a fight, in a violent conflict. So over the months, we will mobilize and also sensitize the local communities on the peaceful coexistence and COVID-19. Will also train key community leaders to basically identify and counter divisive messages, raise awareness and help resolve conflicts, and also support 6 local initiatives led by youth and women with cash grants cash grants of up to 500 Ugandan shillings, basically for them to be able to initiate, design, and also implement peace activities. We thought this is better because the communities do not have a chance to directly contribute to basically strengthening peaceful coexistence. And we saw this as an opportunity that they will have to directly contribute to that, identify a problem that they feel is like bringing about maybe conflict or endangering the social cohesion, and then they design appropriate uh, mechanism as themselves and then respond to that. And I think that is basically what we've been able to do um, as a result of COVID-19, and how we practically made those changes was a bit, kind of a bit difficult, but uh, we managed to walk through. What we did was we had to discuss with our donors when the COVID-19 came in and we paused our programs, we couldn't continue any further. We had to discuss with our donors on the current community needs and also on the need for us to modify or make changes to the project budgets, the project activities, and even the scope of the project, including making no-cost extension requests to our donors. And I think this helped us very much because this helped us to quickly shift to make these changes. And also, we organized capacity building training sessions on use of smartphones, virtual platforms like Zoom, Skype, Microsoft Teams, which helped us to shift to online program. This was basically because the staff lacked limited knowledge on how to basically operate these platforms, which are very key, that can be very helpful, especially in online programming. And we also had to redesign our interventions to address the current and emerging humanitarian needs, integrating into it COVID-19. So the discussions with our donors helped us very much in redesigning these interventions. We made sure that we did this in very close consultation with them and also in close consultation with the community, just to see how much we can involve the community right from the onset of the programs, and to see that we really address the needs of the community. And we also had a team of staff trained on risk communication and community engagement. This was basically by Oxfam. uh, this was very important because when COVID-19 came in, for us, what we just had to do was, at first we had to pause our programs and say, like, this is a healthy emergency, and we do not have like the capacity to respond, because this is not like, we do not have the technical expertise to handle the pandemic and stuff like that. But we then had to sit back and identify our niche, what we could do best in regards to contributing to responding to this pandemic. And I think these were some of the things that we had to do that helped us so much in responding to the COVID-19 pandemic, basically in Bidibid refugee settlement. We, of course, did face some challenges while making those changes. One of it was donor inflexibility. Some donors were not flexible at all. Some of them could not agree that the funds be used for other activities than what was initially meant for. And also, apart from that, we experienced a delayed response from donors. For example, one of the resource partners that we discussed with had to take about 4 months to respond to our request, right from the time that the lockdown was put down in Uganda. That was in March. So that was also one thing that we had to struggle with. But also, while making these changes, we experienced the issue of limited resources, basically funds, and also transport. which are very key in facilitating our response. And we also experienced limited knowledge and expertise of handling a pandemic, but I think this we were able to like overcome by having our staff trained on basically COVID-19 response, risky communication, and community engagement. And lastly, we did experience the challenge of limited access to funds. We realized that though we had the zeal, we had the capacity to in a way support in response, we had limited access to funds, and yet the international organizations and those other organizations that operate in the settlement, most of them had left, and there were critical needs that needed to be responded to. So, and also limited access to internet, smartphones, and the unstable power that made it very difficult for us making some of these changes. Though we had these challenges, there are also some things that went well during our COVID-19 programming. Basically, we were able to quickly adapt to COVID-19 and online programming, where we were able to conduct meetings, online use of Zoom, basically, which was the tool that we were using much, staff meetings, meetings with the partners. One quick example is we had to organize the International Youth Day online with partners and had the FGDs. We had the commemoration basically done online. And were able to have needs assessments conducted. And some of this we had to conduct through the use of phone calls, SMS, because most of the community members lack smartphones and so can barely have access to some of these platforms like Zoom, Skype. And we had to you have programs like the FGDs, the focus group discussion. This was basically on the International Youth Day, and this was done online. We had a dialogue with the youth basically to understand their challenges and stuff like that. And yeah, basically commemorating the International Youth Day online. And another thing was we passed out key messages about peace, about hate, about COVID-19 through the use of radios and songs, which I think proved less costly compared to our usual offline activities. And lastly, we had the full and like more influential involvement of the crisis affected people, especially in what relief is provided to them and how it should be provided to them. This like we had a full participation of the community right from the start of the programs. And I think to us, this is like a huge success because it helped the community on the programs beyond the project period. And of course, we learned some lessons. Uh, in the process, we learned to coordinate and collaborate with almost all concerned stakeholders. For example, the local leaders, the local groups, the UN agencies like UNHCR, the government agencies like OPM, and the local governments, and also other partners. And I think this added value to our response, and it also added value to our visibility, and it also brought about recognition to our programs. You know, there are times you do a program, a very beautiful program, but when it's not really being recognized. And so another thing was clearances. This helped us to have some legal clearances. Um, with this, for example, we had to have the recommendations, the support, close support of the OPM in obtaining MOUs with the government and stuff like that, which is very critical for you to be able to operate in the refugee settlement. And as part of this coordination and collaboration with them, we were able to be given an office space just in the refugee settlement itself by the government, the OPM department. So I think to us, like, this was something great. And we also learned to involve stakeholders and the communities that we target for our programs, right from the onset of the programs through to the end. Uh, we saw that this is very important because it supports community ownership of the project activities or the program activities uh, through to the very end, or beyond the end of the project. When we were doing the ELNA 2 project, running it in a Bidibidi refugee settlement, which is where we had the component of the mass community awareness. The project ended last month, and up to now, there is mass awareness going on. No one is funding it, but the community. The community is the one doing it, and with the bicycles and the megaphones provided to them, they're doing it willingly. And I think this is the value that comes with involving the target communities and stakeholders from the onset of the programs. This helps in the sustainability of the intervention. And we also learned to improve on the staff and the community digital skills for effective online programming that lasts beyond COVID, but also for access to information, and also for information sharing and well coordinated humanitarian response. When we were organizing for the dialogue online during the International Youth Day, we of course faced a difficulty because there was limited access to internet as first of it, but also limited knowledge on how to use the smartphones and platforms like Zoom and stuff like that. So we had to first of all have like a quick training sessions just for the participants on how they can maneuver these platforms, and that helped us very much have a success when we had the dialogue online. And we also even created a WhatsApp group prior to the dialogue, which was good. So these were basically some of the few lessons that we learned in the process of shifting from the offline uh, programming to now COVID-19 and online programming. I think that's it. Thank you.